Hi, everyone. Thank you so much for coming. We're so excited to chat today with these two phenomenal experts in skincare and dermatology. As you know, we're here for our texture and pigment webinar. And with me, I have none other than Dr. Daniel Carrasco, who practices at Sonova Dermatology, Central Austin and Dripping Springs.
Hi, Taylor.
Hi, and then I also have Angie Pennington, who's a licensed medical esthetician who practices at the same clinic, so both Central and Dripping Springs.
Hello.
Hello, hello. We're so excited to have you with us today to chat about texture and pigment and what we can do to help with concerns. So let me get the slideshow up and running, and we'll get this show on the road. Awesome. Okay, so we're talking back to even. The whole goal is to address texture and pigment in the skin. So Dr. Carrasco, tell us a little bit more about things that can cause issues with texture and pigment in the skin.
Definitely. So Taylor, I'll take it from here. So texture and pigment is something that we almost it should be called the Sonova Texture and Pigment Clinic, because we do so much in texture and pigment every day. It's part of our routine in our medical and cosmetic dermatology practice. There's a lot of reasons why people get texture and pigment issues. And like it's stated here on the slides, you can have anything from a hormonal imbalance that needs some medical management. It could be just overexposure to the sun that needs maybe some good sunscreens. There's a lot of genetic variables depending on your skin type and color. There's conditions in your skin like acne, for example, that can predispose you to having, more skin inflammation. If you scrape your skin or you hurt yourself, you can be prone to getting hyperpigmentation. And of course, as we age, we also develop sort of, pigmentary irregularities that happen on our skin. So in medications, we oftentimes forget how they can also influence medically even our skin and even cause us to hyperpigment. So these are all things that can interface with issues with pigment. So it's really important to kind of really, number one, not just look at pigment as just like one way to just treat it with one turnkey cream, for example, that you bought on Amazon. Everyone's pigment irregularity has a uniqueness, and sort of we have to kind of study why that person's pigment is irregular and then dedicate a specific treatment for them. So the purpose of this webinar is really to kind of go overly very broadly to look at the treatments, and then try to kind of talk a little bit about each one and how they work, and then maybe talking to your specific provider to see kind of which one fits for you. So there's always ways to treat pigmentation. We have so many tools in our chest here in our offices. I'm going to list a couple here of like laser treatments and that we have here in Dripping Springs where I practice and where Angie works. We use one of the really the gold standard in laser resurfacing, which is the CO2 laser. And the CO2 laser is really the benchmark laser. Everything's compared against it. So if you ever hear like anyone comparing lasers, like, oh, it's like the CO2, or it's it's kind of like it, because it's really the gold standard to this date. And so other lasers like the Halo, the Sublative, the micro peel laser, the Resurface FX, those are all kind of like lasers that are really great for some people that want less downtime. But the CO2 is the one with the greatest amount of downtime, but also with the greatest benefit. There's also like the pigment lasers, like the Genesis laser, and the IPL, BBL. These are all lasers that really look at pigment without any downtime. And we'll talk a little bit about those. There's also microneedling, which again is something you've probably heard of. That's been really trendy recently, where little tiny microneedles are stuck on the skin, and we can add your own plasma on top of it, known as PRP, that enhances the effects. And then, of course, there's chemical peels, which have been around forever. And we use alpha hydroxy acid, beta hydroxy acid, trichloroacetic acid, proprietary chemical peels that are mixed together from SkinCeuticals and various other manufacturers. So, just getting a good skincare routine with whoever takes care of you here at Sonova is going to be really great to kind of put together a good plan of action.
Awesome. So we talked a little bit about CO2 specifically, but can you tell us kind of how laser resurfacing in general is able to benefit the skin and what it targets?
Yeah. So again, this is a really good topic because, not everyone with pigmentary concerns benefits from a laser. For example, if a person with melasma comes into my office, the last thing I'm going to do is a laser right off the bat, because you can actually make melasma worse with a laser. Anytime you deliver heat or something, even insult the skin with even just the slightest bit of like a chemical peeling agent, you may make melasma worse. So for a condition like melasma, you really need to have someone properly diagnose it so you can sort of properly treat it. So the CO2 laser, which is awesome for like tone and texture, and maybe brown spots from the sun, maybe age spots with time, maybe acne scarring, are really great for those patient types. Okay, but that patient that has that real sensitive skin, where like the second they go out in the sun, they hyperpigment, it's not going to be a good idea to do like a CO2 laser or a halo or any ablative laser like we list here on this lines. So I think it's important that we identify the type of pigmentary condition you have. The CO2 laser is really good for tone, for texture, for fine lines, for wrinkles, for sun damage. Even my patients who have a lot of precancers benefit tremendously from a CO2 laser, because you're essentially taking the top layer of skin off, and guess what? All those precancers are going too. So if you have that really light skin type, CO2 is really for you. If you have more of a pigmented skin type or a skin of color, we need to shy away from the CO2 laser because of the risk of hyperpigmentation. But there's plenty of other things we can do. The nice thing about if you have skin of color is that a lot of times you don't need the CO2 laser, because that pigment that inherently populates your skin is actually very protective.
That's amazing. I love that there are so many different aspects to this, and everything you're saying is super interesting. I would not have thought of it, but what's really important to take away from this is the importance of doing a consultation, because dermatology first, we want to make sure we're addressing the correct concern, not just going after it with everything we've got. So I love to hear that. And so now we're going to take a look at some before and afters. So tell us a little bit about this.
Yeah, so again, I think that this is a really good example, and the next series of pictures will show these. And Angie and I work together hand in hand in doing these lasers, and she really holds the patient's hands from the day 1 to day 2 to day 5. This is a transformative effect you see with the CO2 that happens over the course of 7 days. And so, I think what we're not showing you is, what the in-between days. Okay, so this is great to look at the before and afters, because you really get an idea of what it looks like at the beginning and what it looks like at the very end, when things look pretty good. All these patients look a little bit pink, okay, and they're not done. They still haven't healed completely, because that pink just shows that there's a little inflammation. It's still healing, and that's what you want. You want that pinkness, that little glow that you get behind the scenes. And with makeup, you really can't see this. I mean, these are really transformative changes you could only get with the CO2 or maybe the halo. So I think that when we decide, this is a patient that has alopecia totalis, which is really a condition where you lose your hair, but nevertheless, her skin looks amazing from before and after. I mean, she just really transformed. That's the reason she doesn't have any hair here in this picture. She took her wig off, but nevertheless, really good outcomes. And I think that when you come to our offices, it's good to talk to somebody like Angie, who will show you the pictures that you look like on day 2 and 3, which we're not going to show you the gory pictures here, because there is some degree of all these patients really went through a transformative change, and we want to show you what you're going to look like, so there's no surprises along the way. Angie, I'm sure you've had many consultations and conversations with these patients, on days 2 through 7 or 8 or 9. What's the advice you usually give these patients? Because I know that you see them all the time and talking to them, and kind of, I typically will see like images of the patients. We ask them to send photos every single day as they're healing, and then I see them at various time points throughout the weeks afterwards.
I try to prep them beforehand as much as possible, kind of desensitize them to what their face is going to look like, because they look pretty bad. They're really swollen, they're really red, they're kind of uncomfortable. So as long as I kind of give them a heads up and then hold their hand for that first week post procedure, it works out a lot better. They kind of have scary moments like, am I supposed to look like this? Should I be, consulting a doctor? I'm like,
Right.
Nope, you look perfect. That's exactly what we want you to look like. You're healing great. It's a very predictable procedure, and they all heal very well over the course of 7 to 10 days.
Yeah, sometimes they just need a little kind of just to make sure. It's like, is this okay? Is this okay? And you really need that reassurance every day because you're thinking, I don't know anyone else that did this. So, is this right? Is this normal? And I tell you, it really helps to have, Angie there to see them and talk them, back off the ledge because
Mhm.
sometimes I'll get patients that are a little scared about, what's happening. And, even though you've told them 1,000 times that this is what you're going to look like and you showed them the pictures, but when it happens to you, it's sort of a little scary. So,
Well, scary, but also exciting because you feel like though it can
Yes.
be a little bit intense in the beginning, the exciting thing is that means that things are changing and that you're getting closer to your results. So I'm sure it's really fun to think about it in the time, but
yeah.
it is really exciting to think that you're making these changes. And for lack of better explanation, no pain, no gain. So
Yeah, and in
That's
this
true.
photo in particular, I want to point out here that this patient did have a very good change on her skin, but still, even with like a CO2 laser, you might think, well, why does she have wrinkles and why does she have 11s? CO2 will not get rid of the need and negate the use of Botox. Okay, neurotoxin is still going to be beneficial here. Now I can still see that her fine lines around her lips are so much better, what we call the smoker lines, even though most patients that have those don't even smoke. The wrinkles in between her eyes, which were there before, are softer. But nevertheless, here's an example of like, what? They're still going to need some Botox, even after this. So it's not as if the CO2 or any laser we're going to do is going to take the place of it. It's a program. This is one part of the program. We do some lasers. We do a little bit of neurotoxin to soften the wrinkles, maybe some filler still to kind of fill it up a little bit, maybe soften around the lips. So I think it's a program that, today we're talking about the technologies that are involved in pigmentation and fine lines and these kinds of things, but it's not just a turnkey solution. It's just one venue to kind of get to the next level.
I love that. I love that. Well, speaking of that, let's talk about another avenue that we can take, which is specific to pigment and a little bit more focused on those reds and browns.
Yeah. So if we step away a little bit from like the aggressiveness of the CO2 and those really major transformative changes that we see in our patients in the 60s and 70s, now let's kind of back off a little bit and kind of look at our younger age group of patients who maybe just are having some pigmentary concerns. They during the course of the summer they end up with brown spots, kind of like freckles. Freckles are nice and cute when you're 15 or 10 years old, but as a freckle gets bigger and bigger and doesn't go away, it no longer becomes cute. It becomes like a big sunspot. And so nobody likes sunspots. And that's kind of where we can really pull out some really fun toys that we have in our practice, like the XLV or photofacials, which are really, really tuned to remove brown and red colors. So if you look at your face and you get one of those magnifying mirrors that everyone loves to look at their face under, you start to look at those little brown spots and those little broken capillaries, and those are really what we're targeting. Now, when I'm looking at your skin, under a microscope, of course, I'm really scrutinizing every little fine line and brown spot and telangiectasia. In the real world, you can't see that with your average eye, okay? So, but if you can pull that color out, that pigment, that brown, those little broken blood vessels, every little tiny broken blood vessel, that changes and transforms the tapestry of the skin and really makes the skin so much smoother and brighter. So that's what these technologies do, and they don't have downtime. The nice thing is you do a laser in the morning and you're with makeup and you're out in the town in the evening. Angie, what do you think? I mean, what do you tell the patients about when they do an XLV? I mean, there may be a little bit of brown kind of after a day or two afterwards, but they're really low downtime procedures. They don't have that sort of like you got to take off a week of work. I mean,
No.
kind of like I wouldn't say like it's like a lunchtime like facial. You do it during a very short amount of time period, but there's very little downtime. Angie, what do you tell your patients after you do a laser like the XLV?
Usually any darkening of those brown spots can be covered with a tinted sunscreen or with makeup. The worst thing that could happen would be just a little bit of swelling. And even if that happens with ice, it's going to be gone by the next day.
Right.
So very minimal.
Very minimal. And what Angie's mentioning about, covering it up, because what you do is when you shine a laser on a brown spot, you actually make the brown spot darker transiently. Okay. But that's the process of removing the brown spot. You kind of just, you kind of aggravate it. You hit it with the light and the light actually turns the brown spot darker, and then it flakes off just like a cornflake. I mean, it's pretty amazing. I mean, these things just kind of come right off.
Well, let's take a look at some photos here that are going to showcase some of the things that you're talking about.
Right. And so here is a good example. You know, the décolleté, the chest area, great area for these laser technologies, because this is an area, again, that gets a lot of sun over time. And these are just those large, cute freckles I'm talking about that just don't go away. I mean, here is just before and after with a few laser sessions using, I can't remember if this was a photofacial or an XLV. They both do similar, but
this was XLV.
XLV, okay.
Yeah.
A good example of what you would see from one to the other. Literally, how many treatments was this, Angie?
3.
3 sessions, and that's the average. I would say between 3 and 4, and then maybe like once a year or after the summer, you come back and do some more if you've been exposed. But if you're going to invest the money and do this procedure, and they're not expensive procedures, but you know, we can help you, pair you with the right treatments to kind of protect and keep your skin looking like the after all year long, which may involve like some, you know, antioxidants and awesome sunscreens and things you do to protect the investment. You know, you're not going to go, you know, wax your car and clean it up and then just go drive it in the mud. You know, you want to kind of have it protected. And so this is kind of the idea behind, you know, preventative medicine and sort of technologies that we have now that we can actually sort of prevent the aging process. And once we have re-preserved it, you know, keep it there. Okay, go next slide. All right, so a little pivot here on same laser, but you know, this laser has like 2 settings. You know, you put it on the red or the brown. And the nice thing is these wavelengths target these same colors. We just have to tweak the settings. And now we can go from, this is what I'm talking about when I look under my magnification, I see those little tiny capillaries. From far away, it looks like ruddy skin. But when you zoom in, you can see the capillaries just like a map, a road map. And that laser, it's very satisfying to do this laser. And Angie can probably talk to this, because as you do it, you're literally killing those blood vessels and they're disappearing in front of your eyes. I mean, patients are shocked when they walk out and they're like, oh my God, it's just like in a mirror and it's like gone. It's red, but it's gone. So that's how impressive these technologies are. Angie, do you have anything to say about this?
Yeah, you know, it's fun for me too, because my endpoint is I want to see that little vein change colors. And that tells me that we're going to get improvement. Usually they just shrink up and boom, they're immediately gone. And those are a lot of fun to treat.
Yeah, and a large patient satisfaction. Here's an example of a patient with maybe some brown and red. So again, this is with a photofacial device, an IPL. IPLs are kind of like the tool that's been around for the longest that really works to get rid of red and brown. The XLV is kind of just a more couture, more sort of, it's a very refined product. And I think that they're similar in what they do. They just have different wavelengths, and it's more of an academic question as to which one's better, but they're both very good. And they do similar. So this is an example of what you can do with an IPL photofacial. This is a patient that's had a photofacial and a little bit of filler. Again, what you'll see is even though her skin type you know, is more of an olive complexion. You know, she's not real fair. She can still do photofacials in these patient types. She had an improvement in her pigment, and you can see that sort of that freckliness that she had in her befores are pretty much resolved in the after. Again, even though these are a little blurry, it does help to kind of see how those brown spots sort of progress. As you can see on day 3, they're a tiny bit enhanced because the laser light has essentially darkened them a little bit. And you'll see that darkening a tiny bit. And that's the part that Angie mentioned you can cover up with makeup. And then of course, by day 7, they're all kind of sloughed off and gone. Very similar to the photo we saw earlier on, just an example of that sort of that brown sort of pigment you get on the chest, that décolleté from, you know, summer sun, literally erased with you know, 2 to 3 sessions with these IPL devices.
Well, that's really exciting. I love the fact that there's so many different ways and so many different things that those pigment related lasers are able to treat. So now we're going to kind of take it another step, and we're going to talk about microneedling, which is a little bit more for texture. So tell us about microneedling.
So microneedling was an interesting technology that's relatively new. You know, it's you know, 20 years ago we weren't talking about microneedling. You know, the microneedling really was born out of sort of a way to deliver a really good result on a really inexpensive way to do it. So the technology is borrowed from a fractionated laser technology. So most lasers now are not like one laser, like a laser beam. They're fractionated into tiny little sort of pixels. And so when the laser delivers a lot of pixels to the skin, it burns tiny little holes in the skin, and that's what actually gives you the result. Now, they kind of thought of, how do we achieve this without heat energy and without a huge amount of expense? Well, microneedling. Microneedling uses a bunch of little tiny needles. I don't know, there's like, what, Angie, how many needles on the microneedling device?
36.
36, good. 36 little needles that basically are like a stamping device that stamps your skin up and down. And that thing moves, I don't know how many times per second or per minute. And it stamps the surface of your skin with tiny little needles. And so what that does, it stimulates the collagen and the elastin and improves the tightening of the skin and also improves pigment. So we're able to do it without heat. So it means this is really good for patients who have real sensitivity to like heating devices. If you're prone to melasma or hyperpigmentation, you can use a device like a microneedling device to basically just puncture little tiny holes into the skin. Of course, your skin is numb, so you're not feeling a lot of this because they're going in just microns under the skin. But what it does, they create these little micro channels. And during those microchannels, that's where you can put like PRP on top, which is platelet-rich plasma, which is basically your stem cells out of your body. And they go right through those channels and just kind of really just supercharge the surface of the skin. It's almost like fertilizing the skin. So this is sort of a schematic or a cartoon showing like what it might look like before and after with collagen after you use PRP. We can do PRP full face on the face or the neck. I mean, it's really a cool technology that's been developed that really just allows us to get, low downtime procedures. So there's not a whole lot of recovery like a CO2. Keep in mind, you're not going to get CO2-like results. So you will get some brightening of the skin. And for our, 30, 40-something-year-old patients who are really looking for just a little refreshing, this is a really go-to because, you don't have that time you don't need a CO2 at this point in your life, maybe. Maybe you just need some refreshing. So this is a good way to do it. Now, it can be done with or without PRP. Obviously, you add the PRP, you do add a level of cost to that because you got to harvest the blood, then we got to process it, take the stem cells out and put it back on. So it can double the cost of microneedling, but it can be done either way.
Yeah, I love that there's options. And you mentioned something that I think is super important, which is noting that it's not going to be as much downtime, but it can offer like results in the same area. So that's another good reason to have a consultation, because you can have that conversation about, well, how much downtime are you willing to have? Do you have any events coming up? Anything that would help make a decision as to what direction you'd want to go with your treatment? Right. So let's take a look at some before and afters from microneedling with PRP.
Yeah, so again, these are photos that if you had put, for example, like you had said, these were laser before and afters, I could believe you, but these are actually just PRP and microneedling, which is really just, I think are pretty amazing results, because what you'll see is you not only just feel like there was some tightening here, like skin just looks younger and tighter. I mean, here, way smoother, a lot younger patient, but just really that porcelain skin that you get from this, the pigmentation improved, her texture improved, her pores are better. I mean, she's already pretty good at baseline. Again, another patient, just very subtle sun damage, a younger patient in their 20s who really has really nice skin, who just wants to get a little bit of that brown off there. Ideal for somebody with just that skin type. And if you're looking for these kind of results, you don't have to go to CO2. You can just do something simple. A patient with a little more photo damage, even an Asian patient here with a little bit darker olive more complexion, but very, very good results. And you may wonder, well, they still has these brown spots even in the after. Those are very hard to remove. So I might actually work on those little by little, even over time. And this is only 3 sessions, but you can definitely see a dramatic improvement and even a brightening of her skin. She may even be using some lightening agents to overall just, depigment some of the background colors. But this is a really, really fine result. Good close-up here, as you see right after treatment. And this similarly will yield you can't really see immediately post-treatment, number one in the middle, but if you look real closely, you can see pinpoint where the microneedle gets in. And so your skin will feel like sandpaper after you do it, which is not desirable, but that kind of comes off and it's nice and baby smooth right afterwards after that all heals at about a week.
Well, awesome. So let's talk about another option that's a little more aimed at pigment, but can also deal with texture a little bit, chemical peels.
So chemical peels, God, they've been around since the beginning of time. I mean, the ancient Egyptians used to use chemical peels, alpha hydroxy acids, beta hydroxy acids. They've been around forever. So peels aren't anything new. What we really have learned with peels is that we have to be very careful on who we put a peel on. Not every single person needs a peel. Not every single person deserves a peel, because there's certain skin types and there's that really do well with peels and the other that don't. So I think that even though it's an awesome technology, it requires a little bit of sort of diligence and figuring out where you fit. You know, can you do a very strong trichloroacetic acid peel, or do you need to do like a salicylic acid peel or a Jesner's peel? So there's like 1,000 peels in the market, and trying to pick the right peel is going to really heavily rely on sort of the provider. And, you know, Angie sits down and consults with the patient. You know, she feels like she can do a peel on them with one of those peels that's really not ultra deep, then we'll do them. If we need something more, we'll kind of pull out the big guns and do some combination, you know, peeling. So there's a lot of ways to peel, but I will say that I can do a peel on somebody with rosacea, and we can do a peel with somebody that needs a CO2 laser. So it's really like the gamut. The most appeals we do are the alpha hydroxy acids, the glycolic acids, the salicylic acids that help with acne. So like even things for acne improvement, we can do peels on. So it just depends. Angie, what do you think about, you know, when you do your peels? I mean, do you have like a favorite peel type that you like for your patients? I mean, I know that we share a lot of similar patients, and you know, a lot of times we'll use you know, proprietary peels, but
Yes.
Angie can probably tell you her favorites.
Yeah, I love salicylic peels because, you know, they've been around forever and they're so great for acne, and, you know, softens up the skin so I can do some really nice extractions. But then I also love the newer kind of more sophisticated peels like the Skin Medica Vitalized peel.
Yeah.
And the SkinCeuticals has a new one, the Smart TCA peel. Those peels are just really predictable, and really safe, especially compared to some of the old time chemical peels that we used to do. We had to be very, very cautious then, and you still do, but they are definitely much more predictable on most skin types.
Yeah, I agree. I mean, I think that it's just, you know, we always here at Sonova, we're not going to, we kind of vet a lot of the peels. There's a lot of them out there, and we try to get the best of the best out there, and bring in what, you know, is going to be the safest and most efficacious, and reproduce the same results over and over with the minimum amount of side effects. Because I tell you, sometimes you'll just, we get patients that have been burned, you know, from doing home peels, or, you know, they went to their spa, or they went to go get their haircut and they got a peel when they were there, you know, that kind of thing happens. So, you know, we've had some really bad burns we've seen sometimes. We always remind the patients that we need to be off retinols, you know, before they have a peel. You know, if they're on a drug like Accutane, you can't get a peel. So there's kind of some questions that we ask the patients before to make sure that they are candidates for the peel. Anything they've done to their skin that can make the skin sensitive. If they just, you know, got back from the mall and they did some waxing on their face and they come in and do a peel, guess what? Not a good idea, because you can actually just over peel the skin and now you're going to get a burn. So it's really important, these little finer details, to kind of ask a lot of questions before you even do any peel.
Definitely. I think that's super important to figure out what's going to be best for your skin. And speaking of that, let's go into skincare a little bit.
So skincare is a pretty broad topic, because we have so many, and it's kind of a very customized thing. And that's the reason why maybe there's like 1,000 skincare products on the market, because everybody's skin is very different, and it's not like one turnkey solution for everybody. Depending on your skin type, do you have acne? Do you have rosacea? Do you have brown spots? Do you have red spots? I mean, do you have photoaging skin? Do you have a lot of wrinkles? These are all questions that we kind of ask in our mind when we're trying to put a treatment plan together. So I think that if you have issues with elasticity, if you have issues with texture and tone, oiliness, you know, we can help with that with even medications that help reduce oiliness. One common thing that people commonly ask is like pore size, is like, how can I improve my pore size? And the answer is Sometimes you can't because that's some genetics. So what you will see on a lot of the products that are on the market is pore refining creams. Okay, nobody's going to say pore perfecting because we cannot perfect the art of shrinking a pore that is your God-given pore. But there's ways to sort of improve the appearance of them. If we can reduce the amount of oiliness in your skin, we can reduce those oil glands. We can improve the way the pores look. If we can do a chemical peel and take the top edge off, improve the reflection of the skin. There's many ways we can do to go to improve things like pore size and texture and the oiliness. And a lot of times, you know, maybe even it boils down to some food you're eating that could be causing your skin to kind of react. So those are things that we talk about in the office on a daily basis. You know, Angie's an expert at kind of, you know, assessing patients and trying to help them and guide them through each step of the way on getting them, you know, the products that they would best be matched with. And we do this on a daily basis with our patients, because a lot of times it's kind of like we finish I'm seeing a patient and we're done, and then they're like, oh, by the way, what kind of skin cream do I need? And I'm like, well, that's like a loaded question, because I could spend like 15, 20 minutes talking about skincare. So I don't like to throw just anything at you without asking the proper questions. So I think it's it's very valuable to sit down and talk through a routine. It's not a doorknob sort of, oh, use this cream and we'll be fine. As I'm walking out the door, you know, I might say, you know what, why don't you visit with Angie and discuss with her what your needs are? And, you know, I'll put a couple ideas here on what I think, and then let's sit down and have a discussion. So I wouldn't expect it as sort of just like, you know, oh, by the way, here's a cream out the back door. Okay.
Definitely. And Angie, tell us really quick why you find that skincare is valuable, especially when you're doing things like putting money towards a skincare procedure or a procedure at the office.
Well, of course, like Dr. Carrasco said, you want to protect your investment now. You know, after we kind of get your skin normalized again, get that reestablished, you want to use the best products because they really, really work. I mean, I've seen incredible things from products alone: improvement in the skin, improvement in pigment, and texture and tone. So I think finding a customized skincare regimen for yourself is the best way to do it. Come in, see a professional. I am very well versed in all of these products, pharmaceutical grade products. So like, again, like Dr. Carrasco said, just don't go to Amazon and start looking for skincare, because it is not one size fits all. You know, we can really narrow it down to exactly what you need and what you're going to get the best results with.
Well, I love that. And again, that reiterates the point. We want to make sure that we are using high quality products, but also partnering with our skincare providers, whether that be dermatologists or licensed medical estheticians, to ensure that we are doing the best for our skin. And if we're getting procedures done, protecting our investment, making sure that we're keeping an eye on things like skin cancer development and all that stuff. There's a very wide range of reasons as to why visiting and having a consultation to get a curated routine from your dermatologist is important. But I just want to say thank you guys so much for making the time today. It was so enlightening. I loved hearing everything you had to say about all these great options for treating texture and pigment. And I hope you guys have a great day.
Thanks, Taylor.
Thank you, Taylor.